I would like to start by saying that I'm really excited and really happy to be presenting today on trend analysis from three consecutive Cambodia malaria surveys that have been taking place since 2004. I would like to acknowledge at this point that Sarala, who is the statistician for Malaria Consortium, has been really behind the hard work of doing this trend analysis. So just want to acknowledge that most of the work I'm presenting here has been done through our statistician. In terms of just a little bit of a background of what were the main objectives of the Cambodia malaria surveys, which were really large-scale national surveys looking at showing progress and monitoring impact of interventions, particularly coverage indicators, and also looking at progress on malaria prevalence. As I mentioned, there were three Cambodia malaria surveys conducted in 2004, 2007, and 2010. And just very recently, last year, there has been the fourth Cambodia malaria survey taking place, which the data is at the moment currently being analyzed. Here on this presentation, I will be looking into the trends for the first three surveys, particularly just focusing, because these are very large surveys, are collecting indicators for many different aspects. But for this particular presentation, I'll be looking into malaria prevalence based on blood slides or microscopy, but also on PCR results, and some indicators looking at net coverage, but also particularly in net use. I want to highlight that I will be giving just very preliminary results on malaria prevalence based on the last survey, the CMS 2013. Unfortunately, we didn't have time to present net coverage for 2013 yet, but that will be coming in the next couple of weeks. Before presenting any trend analysis, I think it's important to step a little bit and discuss what were the similarities and differences between the four surveys and the three surveys in particular, because that will be really important for us to know how exactly we could combine or interpret results. In terms of similarities, they were really following very similar designs. It was cross-sectional surveys, looking at two-stage cluster household surveys. In terms of sampling, there were two stages. Risk villages were sampled using probability proportional to size, and also the second stage, the households were sampled using simple random sampling. The timing of the surveys were comparable, so it was very important that they did take place at the right time, right after the seasonal peaks. And the tools were standardized questionnaires that were pretty much very similar questionnaires throughout the whole survey period, but also they were having slightly different modifications based on feedback and experience, and also changes in terms of interventions, but it was pretty much standard. Some differences to point out, which I think it will be quite important to spend a bit of time here. The geographical domains, the surveys were stratified by domains, and those were slightly different throughout the three surveys. Also in terms of the zone, the risk zone, or the stratification of the risk strata were slightly different. That's important because the way on the first survey, a proxy for transmission intensity of risk was actually distance to forest. And that definition changes slightly throughout the three surveys. This slide, the next slide, is just, I'm not going through the details of the tables, but I think it's just to highlight how domains have been shifting or changing slightly through the three surveys, but also how different provinces were moving from one domain to another, which that made it a little bit challenging in terms of pulling data together in order to interpret trends. How we approach that, this slide is really trying to show the first set of bars is really showing what will be the malaria prevalence based on microscopy if we just use the overall estimates of malaria. So for example, 2004, we'll have a 2.8 prevalence overall, and it looks like it's going up, let me see, to 2.9 before going down in 2010 to 0.9 2% of prevalence. However, as I mentioned before, we had 23 provinces being included in 2004, only 13 provinces included in 2007, and 20 malaria at risk provinces in 2010. So when the provinces, the 10 provinces not included in the 2007 were actually provinces considered low risk. So when we are actually looking into the overall malaria prevalence, just looking into those provinces that are common throughout the 3 surveys, the actual trends are really looking into 4.5% in 2004, 2.9 2007, which is the same estimate, was the survey with the less number of provinces, and 1.1 in 2010. So clear decline of malaria prevalence. And this is just to highlight the importance of ensuring that we were really comparing apples with apples and really the same provinces through the trend analysis. Just very briefly, this is more of some of the very preliminary data in 2013, and it's based only on the first reading of microscopy. We only found 14 positive slides at the moment. We are waiting, of course, for the PCR results, which will give us full picture. But it's very, very looking really, really low at this. It's really looking very low at this point in 2013. And again, that's really only comparing the provinces that were common throughout all the surveys. So one of the approaches that we were considering as what will be the best methodological approach to really compare the surveys was really, one option was, why don't we look into trends by province? But because the surveys were not designed to really look into differences by province, it was very difficult to actually break it down by province. An alternative that we thought it was a good compromise was presenting the results by region, only including those provinces that were common throughout the 3 surveys, but allowing the opportunity between 2004 and 2010 to include low-risk provinces. And that's how I will be presenting the trend analysis from now on by region. Just a very busy table, but I'm just really looking at highlighting just the scale of the surveys, how big they were, just to give you a sense that these were really large surveys, national scale, national surveys. We have between 3,000 or 500 households being sampled each time, which in terms of samples for analysis of microscopy at PCR, we were talking approximately with between 8,000 and 9,000 slides, but also roughly between 600 and 9,000 samples for PCR results. We didn't have samples collected or dry blood spots for PCR in 2004, and that data is not available. Just again, another important consideration for the trend analysis was the how we were defining malaria at risk villages and that proximity to forest. There were slightly different definitions in the 2 surveys, first surveys, compared to the last one. And the data is being presented at this point. It's just combining the 3 risk zones, which were defined as less than 250 or 500 meters from forest, between 200 and more than 500 meters to 1 kilometer and 1 to 2 kilometers for risk zone 3. For this particular trend analysis, we did not include villages between 2 to 5 kilometers, mainly because it was only available on 1 survey at the moment. The next set of graphs are showing the trends of malaria prevalence by region. This is the eastern region of the country. You will see for the 3 slides that the scale or the y-axis will be changing. The eastern region in Cambodia tends to have the higher prevalence overall. When looking into the blue line, which is the overall prevalence by blood slide, it was clearly showing a statistically significant decline of prevalence. I think very importantly, that's the same pattern with PCR, but what I think it's quite important to highlight is the decline by species. So very clear declines of If you look at the green, Plasmodium falciparum over the 3 surveys and the 3 from 2004 to 2010, but not much difference, which was also not statistically significant, that was really a very clear decline on Plasmodium falciparum, but not on Vivax. And the same pattern was observed with PCR, even though we didn't have PCR in 2004. The same patterns were really seen for all the regions. So for Western region, much more marked decline from on prevalence, and please note that the scale is different. We have overall less prevalence in the Western region, but still very clear declines overall and very clear declines on Plasmodium falciparum, not so much on the last 2 years, particularly with Plasmodium vivax, which was not really showing any decline. Much harder to see with the central region. As I said, central region in 2007 was not included, no provinces on the central region. So we are only comparing from 2004 and 2007 and 10, and we didn't have any statistically significant differences in the prevalence on the central region. We didn't have PCR, so it was really 1 point estimate. I think this is really interesting to show that the moment we are breaking down overall trends by species, we see slightly different patterns, which has been quite successful for reducing Plasmodium falciparum, perhaps not so much in terms of Vivax. This slide it's a bit complicated to explain, but basically it's trying to see whether there are differences in the trends of malaria prevalence by risk zone, which was defined as proximity to forest. So the risk zone 1 was actually the closest to the forest, villages that were closest to the forest. We see declines overall with PCR, for example, on the eastern region, which are the blue lines, but very difficult to actually see what the patterns were, and they were not statistically significant when we were looking into microscopy. And then the next slide is really just showing the same for the other regions. Very difficult to explain or see any particularly trends here. I think there are potential explanations for that. One is the fact that risk zones were changing, and we were mixing zones 1 with zone 2. Also the fact that proximity to forest was out of date, was based in 2004, was perhaps not the best proxy for defining transmission intensity in this particular context. And just also the fact that these trend analyses were not really designed to pick up differences by risk zone. But I think in this particular case it was quite hard to find or see any differences in declines by risk zones. Just looking into now moving from malaria prevalence to coverage of bed nets and use of bed nets. As I already mentioned, we have been showing in the first section of the presentation just prevalence results. But for the eastern region, I think, which is again similar patterns for the 3 regions that we have seen in terms of coverage of any nets, the proportion of households owning nets or ITNs on long-lasting nets. It was already very high in terms of any nets. We know there is already a good culture of using conventional nets in Cambodia, but the increase of ownership of ITNs and long-lasting nets has increased significantly from 20% to 78%, or even 28% to 71%. That increase has been much more marked in the eastern region compared to other regions. So the eastern region at the moment is showing the highest coverage. We will be looking into the coverage of 2013, and that's our priority now. Just briefly touching on the use of nets, I think it's also quite, I'm particularly much more interested on how many people will use nets on the last night, on the day before. And again, there has been a very significant increase in the proportion of people using nets the night before. And similar patterns, which I will be going perhaps more quickly, but similar patterns were seen in the western region and also in the central region. As I mentioned before, the eastern region had significantly higher coverage and use compared to the western region. which is still relatively good. And in 2013, we are hoping to, after the mass distribution campaign that took place a year and a half ago, we are hoping to see a much higher coverage. And the same with the proportion of people sleeping under long-lasting nets. These are very similar trends with the central region. Again, we don't have data for the 2007 for this trend analysis. And just another way of showing this data, what I thought it was important to highlight is how this coverage was distributed by wealth index, by the level of socioeconomic status in the population. If we look at the 2007 by two regions, Eastern and Western region, no significant difference by wealth quintiles. So we had slightly similar coverage by each of the socioeconomic status levels. However, when we looked into the 2010, it was a slightly different picture. So basically, it's just showing overall that it's a much higher coverage as we were showing before. But by region, we found a slightly statistically significant higher uptake of long-lasting nets in the wealthier group for the Western region, compared to a statistically lower uptake or use of long-lasting nets in the richest section of the population, but that's on the eastern side. So that's something we would like to look into in more detail for the 2013 data as well. This is just another graph to show the similar data that we have shown just before on the graphs. And that's the proportion of households in each of the regions by year using either no nets, which I think it's important to highlight. There is still almost 20% or 17% of population still not using any nets, but also just looking into the trends of how the proportion of households using long-lasting nets has increased, especially almost up to 50% in the eastern region, which I think it's really showing very good progress in terms of potential protection for malaria transmission. And just briefly looking into the key findings in terms of malaria prevalence, as I mentioned, we had by region presenting trend analysis a threefold decrease, statistically significant throughout the three surveys in the western region, a much more marked decline in the western region compared to the eastern region, which was a twofold decrease. And these were both statistically significant for microscopy and PCR. Just very preliminary, as I mentioned, we had overall a 0.2% prevalence based on microscopy. That's only based on first reading. We are waiting for the second reading and the PCR results, which will probably increase, but I think it's showing a very clear downward trend for all the regions. In terms of summary of coverage, overall for the three regions, a clear increase on the coverage of eddy nets, ITNs, and long-lasting nets. The household ownership, I think, has been a really significant progress in terms of having 1 in 4 households with owning one net in 2007 compared to 3 in 4 households in 2010. Use by 2010 has increased even up to 50% in terms of ITNs, and that increase has been much more significant or marked in the eastern region compared to the western region. And just my last slide in terms of moving forward. As Malaria Consortium, we have been supporting monitoring and evaluation activities in the region, but I think in terms of looking at particular large-scale surveys, I think it will be very important to start paying attention to how we utilize these surveys to look at potential clustering of malaria cases, hotspots, and perhaps really start thinking about alternative M&E tools. It's becoming harder and harder to interpret trends when the transmission is so low and prevalence are really lower than 1%. So it's just bringing a healthy discussion on what alternatives we will be needing to keep on monitoring progress. And if we maintain large-scale surveys, we need to start thinking into standardization of methodologies and how we could support re-stratification of malaria at risk so that we can account for trend analysis. So these are just some of the quick way forwards that Malaria Consortium will be quite interesting to keep on supporting in the region. And of course, my last slide, this has been a very detailed analytical work, but it would have not been possible without the support of all the partners that supported every single Cambodian malaria survey since 2004. Thank you very much.